Hey guys, I am Dr. Cole with Mid-Atlantic Chiropractic. Today I'll be doing a routine chiropractic maintenance adjustment for Miss Gloria here. Typically we'll have the patient either start face up or face down. Today we'll start prone, so Miss Gloria, I'll have you go on your belly for me. So the first thing I do with every patient is I'm going to evaluate their listings, take a look at what their chief complaints are, and today we're just doing a wellness adjustment. So I like to do leg checks before every adjustment. Miss Gloria does not have a elevated pelvis on the right or the left side, so typically her legs are generally pretty even, but we do what's known as counter nutation for Gloria, meaning we're trying to bring down that sacral base angle. Counter nutation means rocking back this way. So this is caudal, this would be cephalad meaning the head, caudal meaning towards the tailbone. For counter nutation, what we'll do is we'll take a big deep breath, Miss Gloria, hold it, exhale, good. And again, big deep breath, hold it, exhale, and one last time, big deep breath, hold it, exhale. And so we're doing the big deep breath, hold, to help use the diaphragm to help traction out those lumbar discs. Gloria does have some rotation based on her x-rays from L1, L2, and L3. They're rotated towards the right. If you imagine my thumb is the spinous process. So what we'll be doing is contacting on the lateral aspect here to help rotate that bone back. So I'll be using more pressure on the left-hand side of my thumb, and we're going to be doing this motion. So I'm going to have you take a big deep breath for me. All the way out. Good. And again, big deep breath. All the way out. And one last time, big deep breath. All the way out. And recently, Gloria's been having some discogenic back pain without radiation. So we're going to do a couple of drops, I to S coming up. And these first two are actually going to be A to P, meaning anterior to posterior. So 2 down, and then we're going to do 2 I to S or caudal to cephalad, meaning we're going to tissue pull up. 1. Good. And then we're going to do a flexion adjustment for her thoracic region. It's going to be upper thoracics around T4 through T8. So I'll have you go onto your back for me. Put the mic down here, and then I'm going to have you interlock your fingers behind your neck. Elbows are going to come on in together. I'm going to have you come on up. Big deep breath. All the way out. And again. We're going to do all the way down here. Beautiful. So that would be to help the kyphosis here in the mid-back. And then lastly, we're going to be doing some lateral flexion in the upper cervical region and some extension as well in the lower cervical region. So is that tender there? Mm-hmm. We're going to do some lateral flexion up top here. C1. Come all the way across. Oh, free one. Beautiful.
It's ready to move.
And then lastly, some extension. Big one. All right, that's moving better. We'll do some distraction here. Make you a couple inches taller. All right, so that'd be a pretty routine chiropractic adjustment. We only adjust what needs to be adjusted based off of the x-rays. We're very specific about our listings. Thank you guys for watching the video.